Well, I am so excited to have Larry Minnix and Katie Smith Sloan as part of our 60/60 tour. I think you all know that Larry Minnix was the first executive director of LeadingAge, and Katie Smith Sloan is the current executive director of LeadingAge, our national leadership right before us. So I want to ask each of you to take us through a journey, help us understand a little bit about the journey over the 60-year period of LeadingAge, and even a little bit about where you were in the 60s and what you're looking forward to in the years ahead. So Larry, why don't we start with you? Tell us a little bit about, first, where were you in the 60s? We do want to know a little bit about that.
Well, I was playing Little League and going to Methodist Youth Group in the 60s. And I grew up here in the Atlanta area. And I remember in 1965, our church was promoting the opening of Wesley Woods Towers, which was one of the first HUD 202 programs in the country. And my mother was one of the original volunteers to help get it open. And fast forward to 1973, and they hired me to be the administrator of Wesley Woods Towers. And I stayed at Wesley Woods with various positions over 28 years, the last 10 of which I succeeded the founding CEO, Scott Houston. And that's when I went to, at the time, it was ASA. So I am the first CEO of LeadingAge under its new name.
Katie, this would be a better question to ask you if Larry wasn't here on the call, but I am so curious what Larry was like, as a leader. I mean, he's so just gregarious. I'm trying to imagine what some of your meetings were like when, throughout your journey.
Yeah, this ought to be
good. So you're right, gregarious is right, but I would say very purposeful and strategic. My favorite time was when Larry and I would get together early in the morning, and he'd start talking about something. I'd have no idea what he was talking about, and he'd look at me, stop talking, and he'd say, "I think I just had a meeting in my own head." And he'd had a meeting while he was in the shower, while he was driving to work. And he thought that perhaps I was part of that, but I was not. So no, Larry and I were a great team for, what was it, Larry, 10 years, I think. And
oh, man, I tell you what,
I learned a lot from him.
I came out of the provider world, but she kept the consumer focus in front of us. Has taken that to whole new heights, because the association doesn't have a reason to be without benefiting the public. So she led us through the brand change, and I got us structured with our state associations and helped us. We got rid of 7 corporations and related association. We became a collection of non-dues revenue businesses that most of which were not helping us much, and we got refocused on one corporation. Members pay dues. We have a really good program. We got to some of the best education and convention people anywhere that made that profitable. We changed, created a new sponsorship program, and our business friends did their part. And it was because of all that we got into the Leadership Academy, which in my career, the Leadership Academy is the single most important thing that I was ever involved in professionally.
But maybe you could tell us, you probably weren't even alive in the 60s. So maybe you could tell us about where you were in your early days, and tell us where what is LeadingAge today and where is it going?
So in the 60s, I was a babe in Manhattan, New York City. And, fast forward to right out of college, I came to Washington and I worked in the Senate, and I worked for a senator who was chair of the Aging Committee. And that's where where the bug bit me. And I decided that I really wanted to make a career in aging, not knowing anything about what that actually meant. But I remember so well helping to put on hearings on the Older Americans Act and really hearing about real lives of older people and having to make choices between medicine and food and heat and electricity, and realizing that we were not, as a country, treating our older adults well. So I spent a chunk of time at AARP trying to bridge policy and program. Did a lot of their program work with volunteers on a range of issues: consumer protection, health promotion, grandparents raising grandkids, economic security, a whole lot of issues. And then sort of had this seminal meeting with Larry and switched directions. I actually think when I look back on AHA, then ASA, then LeadingAge, I think one of the most pivotal moments for this organization was in the mid-'80s when they expanded the name from AHA, American Association of Homes for the Aging, to American Association of Homes and Services for the Aging, recognizing both the direction the field was going in, but also the opportunity to impact so many more lives by embracing services as a key component of the portfolio. And that part of LeadingAge has just grown exponentially, as you well know, Jeannee, over the years, and will continue to grow as our field changes a lot.
You know what I really respected and enjoyed learning more about the past several years that I've been involved is that continuum and the linkages of the continuum across the care delivery system, especially outside of the hospital setting. What do you foresee the next 10 years look like for LeadingAge California? And maybe what are some of the key initiatives, even including, organizations like IN2L, our business partners? How do we see the evolution of LeadingAge moving forward, which I, by the way, think is a masterful name?
Yeah, well, I think, there's certainly a big political push and obviously a practical consumer push towards more and more services provided in homes and communities. And where I hope we end up is much more of a blending of those. Right now we exist in a whole lot of silos, and largely because of funding. And I think that we have to move towards a blending of those, which includes things like what IN2L offers, which is, helping to improve the quality of life of older adults with dementia. And I think we can get there, but it's going to take a lot of intentionality to move in that direction. I also think that, aging is not a linear process, right? People don't go from this service to this service to this service. Their needs change all the time. And their service needs change. And we need to recognize that as a country as we organize services.
I'm retired and within 2 years wound up with a serious surgery problem. And I'm sitting in a hospital after 3 admissions of all that with a temporary ostomy, and my goal in life became to get 2 laps around the nurse's station. And I said, damn, life's got to be better than this at this age.
And Katie, you were masterful. There was no association that surpassed LeadingAge during the pandemic. Just really remarkable. And I think as a result, you and LeadingAge staff have set the bar very, very high for information sharing and engagement. I mean, our members regularly comment on the still regular, not daily, but regular, afternoon, they're 11:30 here. So 11:30 to 12:30 meetings, the briefings. But I want to ask you just one last question, and that's about workforce, because we've got technology, workforce, leadership at the Larry Minnix Leadership Academy kind of converging. What are some of your thoughts to close out on how we need to look at workforce relative to your thoughts that you shared a few minutes ago on how there's going to be a blending of, or how there should be a blending of the services that we provide today. So what are your perspectives on workforce, technology, leadership development, and how we need to continue to focus on that going forward?
So I'm glad you brought it up, because there is no bigger issue facing our members and facing the future of our field right now than workforce, I don't think. And I think in the context of thinking about the continuum, we need to start thinking about much more of a universal worker idea, people who can work across settings. Right now, our system is just, we've got a guild mentality. You've got this title and you can do these things, and then you have to go do this title and you can do these things. And I think we need to break that down and really look at what are the competencies that cut across these settings, and then train to those and certify people to those kinds of, otherwise we're not going to be successful. We also need to focus on professionalizing our direct care workforce. We need to start paying the livable wage. We need to start creating career paths. We need to create healthy cultures so that people want to stay in their jobs. And that's a big focus of ours right now. And then in terms of leadership, I think there's a strong connection with our diversity, equity, and inclusion priority, which is a big priority for us right now. And right now, our member organizations, as you well know, there's a lot of diversity, but there's not a lot of diversity at the top in leadership roles. And that's on us to create those jobs, to attract people of color to working in leadership roles in our sector. So we've launched this internship program this summer, and 38 members have signed up to host an intern, and we have a nice partnership with the United Negro College Fund, historically black colleges and universities, to try to attract students to work in our field. And I looked at the pool of candidates who are applying. We're hosting one of those interns at LeadingAge, and the pool of candidates is outstanding. So we're bringing on somebody who's getting her master's in public health to work at LeadingAge this summer, who is really excited about understanding our field as a career choice for her. So all of these things come together, whether it's at the direct care level, whether the leadership level, it's all part of a big challenge that we have to address together.
Well, I want to thank you both for being here today. Larry, for getting to know you over the past 5 years and hearing your strong leadership and evolution of the organization. And Katie, really getting to know you much better as well. We started the same year in our CEO roles.
That's
right. And you've been such a great partner to California these past many years, but particularly the last 5 years since I've gotten to know you. And Jack, of course, we're like tied at the hip now